to our third Ethics Breakfast of the year. My name is Father Tom Daly, and I manage the work of the Forum for Ethics in the Workplace. On behalf of the board members who are here, welcome. As we continue our discussion of the Neighborhood Improvement Zone in Allentown. In the last discussion, we looked at the first of those terms, the neighborhood, and what is the neighborhood, and who owns the neighborhood now, and how is that changing as a result of what has happened. And today we're going to look at the second term, the improvement. What improvement has been made, not just in terms of the actual commerce in the zone, but in terms of the culture. How has the development of the business and corporate entities impacted the rest of life here in the Lehigh Valley?
And so 2010 was a time when we sort of asked, how could we provide the most value to the people we serve, mainly the 20,000 households in downtown Allentown. How could we enhance their health, and how could we enhance their quality of life? And we came up with a couple of principles. The first principle was that let's move away from this concept of regional tertiary medical center, and let's seek to be an outstanding community health network and community hospital. And the way we define that is that you cannot provide medical care in isolation. If you're truly seeking health of a community, it would be our goal to connect medical care to social services, to community services, to behavioral health, to housing, to a broad array of needs that impact health. So we made a commitment to rethink that and decided that let's work really hard at becoming very good at that approach. And then the second principle was, as the NIS was sort of percolating at the time. We weren't really sure what it was. We knew that it might be good and that we were going to begin it. So we said, we really should commit to being an important part of the revitalization of our neighborhood and of downtown Allentown, and commit to becoming a growing economic anchor to the community. Even at that time, we were the second largest employer in the city, and so we started to look at it from that perspective as well. How could we grow? How could we, improve the vibrancy of our neighborhood, downtown Allentown? So, with that history, the neighborhood improvement zone really has turned out to be, an asset to us. It has accelerated our progress in achieving those goals. And, not just from an economic perspective, and there are economics here. It is a very powerful economic empowerment concept, more powerful than other empowerment zones that I've seen in past experiences. But some of my remarks will talk about the psychology that it created around our neighborhood and our hospital. Just the positive energy, the sense of momentum, and the network of relationships that came out of it. Because I think that's the more powerful aspect, to be honest, of the neighborhood improvement zone. So some facts for you. The good news is we are growing again as a community health network and as a hospital. And I'll give you some numbers. In the last 5 years, our patient service revenue has increased by about 20%. But that's not dramatic, but it is helping. It's a little bit faster rate than the statewide averages, so we're pleased with that. If our revenue is going up 3, 4, 5% a year, that's a very healthy growth rate for our industry. And we have added about 300 jobs to the campus. We've gone from about 1,100 to actually about 1,450 now. And not all of that is jobs that we employ. Some of that is partnering and bringing new services to the campus. But that's a healthy growth of jobs to the downtown economy. And we've seen an increase in activity on the campus, also about 20%. And this year we're projecting about 300,000 patient encounters on 4th and Chew. And obviously, the more traffic, the more energy to the downtown.
It's one thing to knock down buildings. It's one thing to create low-paying jobs, and then we find out after it's happened, and it's kind of painted as this beautiful picture. But just be upfront with it. If you know that you're going to create gave, say, 200 low-wage jobs stated. And that's what would be done in the neighborhood impact study. People who are creating jobs, people who are developing, they would have to go into a neighborhood and they would have to state, okay, we are going to displace approximately 50 people. We will have to demolish this many homes. We will rebuild this many homes. We will have a first entry policy, which means that a percentage of the original residents that lived on that block would have an opportunity, the first opportunity, to access some of those homes. And we have great programs now in town, such as the CACLV. They have a home ownership program class. I went through it. What would it look like to beef that up so that when they kick me out of my home, I am able to come back and purchase one of those homes that they just built? What would that look like? So it's not that the NIS is just this completely negative new idea or new entity. It's that it could be so much better if we implemented the correct policies, the correct programs that other cities have done, and we really thought about Ethel, who was kicked out. We really thought about my neighbor at 940, the people of Allentown. It's not just about big businesses. It's not just about money. It's about the people, and we're being displaced. And that's where I'm coming from. And once again, I know sometimes it's not the popular decision. It hasn't made me very popular, but it needs to be said. And unfortunately, Ethel doesn't have the voice to say it, so someone has to speak for Ethel. And I just thank you for giving me the opportunity to come here, and thank you.
Indeed, we wanted to hear that voice because, as we all know, when it comes right down to it, culture and ethics is ultimately about people.